prone extension test is a test that can translate into upper and lower cross syndrome. So that's what we're going to take a look at next. Now, in the patient with upper cross syndrome, you're going to find that they get overactivity of the upper trapeze levator, tipping the head back and kind of limiting their restriction restricting their movement through the thoracic spine. In a patient with lower cross syndrome, you'll tend to find that they either lift the feet off the table or they really start to fold in the lumbar spine, preventing them from getting good segmental motion. Now, as we take a look at this test isn't about how much range of motion they have. It's not about how much strength they have. It's about the quality of movement. Remember, those joints are supposed to translate and tip in order to create flexion and extension of the spine. So what we're just looking to see is, do they intersegmentally extend through the thoracolumbar spine to raise themselves off of the table? Some of the more common findings you might see, they'll tip the head back, and if they tip the head back, that's actually going to facilitate more activation in the lumbar erectors, making it more likely to give you that lower cross type finding. So if they do that, I'll ask them to just tuck their chin and hold it in while they're lifting themselves up. You may also see that they start to raise asymmetrically from one side to the other, particularly if they have imbalance in the quadratus lumborum and its relationship with the obliques. So that might be something to look at as well. If the feet raise off the table, you may notice that you have overactivity of the hamstrings or some sort of lower cross dysfunction that the patient's dealing with there as well.